I'll be showing you guys the difference between cathing laying down and sitting up in your chair to use the restroom. And I'll be answering some of you guys' questions on how to use a catheter, how to know how far you should insert the catheter, why using a catheter makes you sometimes bleed, and also why does a catheter keep pushing out when I'm cathing. And I'll be explaining some of the difference between laying down cathing versus sitting up. And this is going to be the uncensored version. Relax guys, I'm just demonstrating with the water bottle since there are little kids that watches my videos. You little pervert! So I'm going to be showing you guys some of the difficult... I can't say that word. So I'm going to be showing you guys why it could be quite difficult to cath laying down. So some of the reasons why people have to cath laying down is because they're most likely bedbound from an injury or they just had surgery. Or another reason is because they're pretty lazy. So some of the things that you'll be needing to cath laying down is a urinal, a catheter, iodine, lubricant, iodine, and one glove. And I know a lot of you guys are probably thinking, why aren't you using 2 gloves for a clean glove, dirty glove technique? Well, the technique I'm about to show you, you don't need a glove actually. So before I cath, I need to set everything up so I'm not struggling, try to hold my pants down while trying to get everything ready. First thing that I'll do is I'll grab my leg and I'll cross it like this. And the reason why I cross it like that is it just allows the urinal to stay in one place without moving around and things like that. And when you have the urinal between your legs, make sure it's tilted up so that pee doesn't spill out.
Wake your bitch ass up, Lucky Charms.
Then I'll peel open the catheter, and on the other side, it doesn't peel, so I'll just rip it off with my teeth. And I just peel it about an inch or 2. Then I'll get lubricant. I'll put a good amount on there. And then I know a lot of people, they'll use their gloves to smear it. Do not do that. That's very unsanitary and you could get a UTI. So what I do is I use the wrapper to smear it around. And it's good to always make sure you have a lot of lubricant on it, because if you don't, it's going to be very difficult to try to insert the catheter. And besides the fact that lubricant allows it to go in more smoothly, it also prevents you from bleeding. Hello, I'm recording. Oh, yeah. I was gonna call you, but I use a different technique now because Dad threw away the bananas, but it's alright. So I'm using a water ball to demonstrate something. But anyways, I was gonna ask you to buy a banana, but then again, I was thinking, oh, it's kind of a little sus, like having a woman buy a banana. Anyways, so I'm using a water bottle instead. Yeah. Anyways, I'll talk to you later. I'm recording. Alright, bye. And I'll be telling you more reasons for what causes you to bleed while cathing. So then I'll open up with the iodine, and then like I said, I'll be demonstrating with the water bottle. You little pervert! And you could pull your pants all the way down. I'm sorry, I thought this was America! Or what I like to do is just hold it down and grab it, and then I'll clean it and then insert it so you get the iodine. You start from the top and then you work your way all the way around. And then you get your catheter and then pull the wrapper back with just your pinky. And then you just insert it. So when you're inserting the catheter, make sure you're holding it with your whole hand and not with just your finger. Because I noticed when you hold your private part with your whole hand, then it allows it to go in more smoothly and make sure it goes into one direction. So you're going to insert the catheter very gentle, and you're not going to force it in. You're going to use just your fingers to lightly push it in until it stops on its own. And the reason why it stops on its own is because there is a muscle tissue that you need to push through in order for you to reach to the bladder. And once it stops on its own, after lightly pushing it in, then you'll push it in an inch more, then it'll reach into the bladder. And you'll know if it reached to the bladder if there's pee coming out. And if there isn't pee coming out and you pushed it through, then most likely your bladder isn't full. One of the reasons why a catheter will be pushing out while you're cathing is because you have a really full bladder. And so you should be holding the catheter with your hand and not just let it just dangle. You shouldn't just... So always make sure the catheter is in your hand and it's secure so it doesn't push out on its own. So make sure the wrapper is in the urinal. Slowly insert it with just your fingers. And then once it stops on its own, insert it only an inch more, and that's when it goes through the bladder tissue. And then you'll see pee coming out, and that's when you stop. Because if you keep inserting the catheter after pee is coming out, then you could potentially make yourself bleed. Fucked up now. Also, if you are bleeding while cathing and you're not forcing it in, you could probably have a UTI. And when I first had a UTI and see blood coming out, I was freaking out. What? What the fuck? I could make a whole video about how to know if you have a UTI, and I'll make that UTI video if this video gets 50 likes. Also, if you're getting any value from this video, then consider subscribing if you're not yet, and turn on the bell notification so you don't miss out on any more videos like this. Now here's the reason why I hate cathing laying down. It's because there's no gravity to help you push out your pee, and so you gotta keep pushing, and it sucks because it makes you lightheaded. It's like blowing into a balloon. It's gonna make you lightheaded, and it's gonna hurt your stomach, and you're gonna get a cramp. Also, another thing why it sucks to lay down while cathing is because while pushing you could poop yourself. So always make sure you do your bowel movement before cathing if you're in the hospital, or someone that's just bedbound. And sometimes it could be quite difficult to insert the catheter while laying down, and so I notice it's easier to sit up while cathing. And so you could just incline your bed to help you cath, and then also so you don't need to keep pushing. And so since you're laying down and you gotta keep squeezing your stomach, it's gonna take longer to cath. It takes about a minute or two. So that's why I prefer to sit up while cathing. So once you insert it an inch more and pee start coming out, you'll just wait until you don't see any more pee going in the urinal. And when you see that, then you'll slowly pull it out so it reaches the bottom of the bladder. And what I mean about reaching the bottom of the bladder is, since your bladder isn't as full, you need to lower the catheter so it reaches the rest of the pee. And if you don't empty your bladder all the way, then you could potentially get UTI, or you could pee yourself. And then when you don't see any more pee coming out, then you'll pull it all the way out, and then make sure you aim the catheter up. If not, you'll get pee everywhere. So once I have it out, I'll put everything in my glove. No, it broke.
Well, it's your fault the condom broke.
I'll put everything in my glove and I'll throw it away. And then I'll have my dad or the nurse or whoever to empty my urinal. And the reason why I don't like cathing in my bed, besides the fact that I had to keep pushing on my stomach, is because I don't like to rely on people to always empty my urinal because I feel very lazy. I like to be independent. It's a B-roll.
You look happy, you look disappointed.
No, I'm gonna look like a douche. I'm gonna look
Burden.
A burden? Yeah, a burden.
Take one.
Okay, thank you. So I'm actually bedbound due to some serious injuries that I have, and so I'm not supposed to sit more than 5 minutes. So the only time I'm able to sit is when I'm using the restroom, go get something to eat or drink, and then also to shower. So here are some of the reasons that I prefer to sit up to cath, besides the fact that I like to be very independent and not lazy. It's because I don't want to have a bottle of pee in my room, smelling out my room. So when you're cathing sitting down, it's quicker, and so it takes about 30 seconds versus 2 minutes on the bed trying to cath. So when cathing using the restroom, all you need is All you need is a catheter, iodine, and lubricant. Man, I'm so dyslexic. And also I forgot to mention, you also need one glove, and that's all you need. You don't need to use clean glove, dirty glove technique like they teach you at the hospital. They go off of books, while people like us, we go off of experience, because for us, we figure out new techniques to make things quicker. So regardless of clean glove, dirty glove technique, you're still touching it. So I'll be showing you how I use a catheter in a sanitary manner with only one glove and without touching the actual catheter itself. So what I do is I just peel this off just a bit, and then since this doesn't peel, I just rip it off. And then I only peel it about an inch or two, and then put a good amount of lubricant on there. So I use a wrapper to smear it. And you gotta make sure to put a good amount of lubricant on, because if you don't, then that's what's going to cause you to bleed. Because lubricant, it just allows things to glide in much easier. So as you see, I'm setting everything up before I pull my pants down, because it's kind of difficult to try to set everything up and hold your pants down at the same time. Just peel the iodine wrapper, and I leave it halfway. So I know a lot of para ladies who like to use male catheters, and the reason why is because male catheters are much longer than theirs, which is only this long versus this long. So that's why they prefer to use this, since it sticks out much longer for them. So leave in the comments. So leave in the comments below if you're a woman that uses a male catheter. I don't want to be rocking back and forth to pull down my pants and then also rock back and forth to pull it back up. It's a hassle, it's too much work and extra steps. So I'll be showing you a quicker method that I do. Imagine this is my penis.
I woke up this morning as a Christian.
So what you gotta do is pull your pants away from you and hold your private part. And the reason why it could be kind of hard to insert the catheter with just using your fingers is because your private part is flimsy. And so using your whole hand, it pretty much secures it and it allows the catheter to go in much smoother. So now that everything's set up, I get the iodine. I'll start from the top and then work around. And then I'll get the catheter. I'll peel the wrapper back and then I'll insert it. Insert the catheter with just using your fingers and don't force it in. Just let it stop on its own. And so when it stops on its own, you just push it in an inch more and now the catheter is inside the bladder. And then when you push it in an inch more, pee will come out, and make sure you use the wrapper to aim in the toilet. So once you see pee start coming out, don't keep shoving the catheter in or you can make yourself bleed.
You done messed up, Aaron!
Which I used to do all the time when I was first paralyzed because I kept shoving it in and make myself bleed all the time. I thought I had a UTI. So when you're holding the catheter, don't just let it hang. Don't just let it hang. Make sure you hold onto the catheter so it's secure so that it doesn't push out. And when I'm cathing, I like to squeeze the wrapper every now and then to see if there's still pee coming out, since it's easier to see. And then once I notice that there's no more pee coming out, then I'll slowly pull it out. And then more pee will come out. The reason why you need to pull the catheter out, The reason why you need to pull the catheter down slowly is because once your bladder is not as full, you need to lower the catheter down to reach the bottom of the bladder to get the rest of the pee. And then you got to keep slowly pulling it down where it goes all the way to the bottom of your bladder. Real quick, if you're getting any value from this video, then hit that like button, and if you're not already, subscribe and turn on the bell notification so you don't miss out on anything. And then you gotta keep slowly pulling out the catheter until it fully comes out. And then make sure you always aim the catheter up so that you don't get pee all over yourself. And then you just use your one glove, use it to put your trash in, and throw it away. Leave in comments below which one you prefer to do, laying down while cathing or while you're sitting up. Also, if you like my dad's acting skills, then leave in comments below because he reads every comment. If you want to know 5 things you could do to prevent getting UTIs, then you can click this video right here. And if you want to know how you can do your bowel movement in less than a minute, then you can click this video right here. Like, comment, subscribe, and also share with a friend. And I'll see you in my next video. Bye.